Hello doctors, on this program what I want to talk about is two terms. I want to talk about the terms subluxation and spinal instability. I am a doctor of chiropractic. I have been a licensed doctor of chiropractic for I think now close to 30 years or maybe even slightly over 30 years. I got a license in 1988. You can do the math, whatever time it is at this moment that you're listening to this podcast. So in my profession, there's a term called spinal subluxation. Very important because it's what happens in injuries to the spine. A spinal subluxation is probably one of the most misunderstood terms in my profession. It's a very simple term. And doctor, if you're listening today and you have any confusion, hopefully on today's podcast, we're going to remove all your confusions. So the term subluxation or spinal subluxation in chiropractic, and it's gotten a bad rap, it's gotten a bad name. A lot of doctors don't even like to use it anymore. In my experience, they don't like to use it because they don't understand what it is. And they don't understand how to evaluate it, how to find it, how to remove it. They don't understand any of that. I didn't either as an early practitioner. So my education did not provide me with an understanding of what it was, how to locate it, and how to remove it, even though I went to one of the finest chiropractic colleges in the world. So I'm sure a lot of you are in the same position. And if you're young and you're a young provider, it's even been worse because the more as time went on, the more confused the market became about the term. So a spinal subluxation is nothing more than a misalignment of the vertebra or a vertebra that is in abnormal motion that causes nerve interference. And the nerve interference might be motor, sensory, or pain problems. Now, we could say visceral as well, but that's a little less explored or a little less understood. So today we're just going to stay with motor, sensory, or pain. So if you have an abnormal position or abnormal motion in the spine and it causes a motor, sensory, or pain problem, you have a spinal subluxation. Now, my colleagues have confused that term with what's called a medical subluxation. And a medical subluxation is defined as less than a full dislocation. And you see it on x-ray. If you see a misalignment on x-ray, medically, that can be called a subluxation, but that's not what the profession of chiropractic called it. The profession of chiropractic calls that a misalignment. If you have a misalignment that's not causing a motor, sensory, or pain problem, then it's just a misalignment. But when it bridges over or it clinically starts to express itself in a motor problem, a sensory problem, or a pain problem, then you have an active subluxation. Now, there's another term medically that means the same thing. And it's very important in the injury market because the condition that I'm about to share with you is the condition that causes the most amount of chronic pain and disability in the world today, and it's called a spinal instability medically. So a spinal instability is abnormal motion in a motion unit, vertebral bodies. When they abnormally move or excessively move, and it causes a motor, sensory, or pain problem, it's called a spinal instability. Now, a spinal instability in medicine is exactly the same thing that a spinal subluxation is in chiropractic. They're identical. The only problem is that most doctors of chiropractic, and I am a chiropractor, I've been a chiropractor licensed, I guess, like I said, for 30 years. I teach, and I know the confusion that's in the market. Most chiropractors don't fully understand what the term spinal subluxation means. They don't understand that a spinal subluxation, and doctors, if you're listening today, that if you have an abnormal motion pattern or an abnormal alignment pattern, and it causes a motor, sensory, or pain problem, you have an active subluxation. Now, you also have an active spinal instability. And like both terms, it requires x-ray findings plus motor, sensory, or pain clinical correlation. The examinations are very, very easy to do. They're not standardly being done in my profession of chiropractic or in medicine. Not today. A spinal instability examination is not standardly being done. I've been teaching this information for quite a while now. It should be a standard practice in every chiropractic college. Now, if you remove the motor, sensory, or the pain problem that's associated with the misalignment or mismovement pattern in the vertebral bodies itself, you have removed the spinal subluxation and you have removed the spinal instability, even though the excessive motion is still there or the misalignment is still there. If you remove the clinical aspect of what you're seeing on imaging, you have removed the subluxation or you've reduced the spinal instability. It's just that simple. Now, it's very, very simple to show you what I'm talking about. If I take a pinwheel and I run a pinwheel on the upper part of my outside lateral part of my arm, it's the C5 dermatome. It means the C5 nerve is somehow affected. Now, I can go to the C5 nerve, which I know comes out of the C4, C5 motion unit, and I can look and say, is that misaligned or is there abnormal motion there? And if I have this sensory problem, I'm going to see a misalignment or abnormal motion at that unit. And that's what a spinal instability is, and that's what an active chiropractic subluxation is. Now, I can address this nerve condition by addressing and bringing into better alignment and restoring the neuromuscular control of the motion unit through spinal adjusting. And I can reduce, if I reduce now this sensory problem, remember I said motor, sensory, or pain problem, if I reduce it, I've reduced the spinal subluxation. I've reduced the spinal instability. But routinely understanding each and every level where it comes out is the job of my profession, the profession of chiropractic, and it should be routinely being done and routinely reported, especially in injury work, right? Because in injury work, the ligaments and damage to the ligaments are the most debilitating condition that you can have. So being able to perform simple evaluations should be very, very easy for most doctors of chiropractic. But all I wanted to talk about today in today's program is there's this idea of the spinal subluxation and not understanding really what it is. And I'm sure there may be in controversy in what I'm saying. If there is, put your comments down below. Because understanding this is the road to standardizing the workups. One of the biggest problems in my profession is there's no standard workups. And there has to be standard workups. Imagine if you had the profession of dentistry and all dentists were looking for cavities, but they were all doing it in a different way. There was all kinds of different techniques to try to locate those cavities. It would lead to a pretty confusing profession. In the injury market especially, if you're a doctor of chiropractic right now, we need to standardize our examination procedures. And understanding these key two terms is one step toward aligning and standardizing our procedures. And that's what I wanted to talk to you about on this program, on this podcast today. Again, in the Smart Injury Doctors program and the Smart Injury Doctors podcast, all I'm looking to do in these podcasts, especially when it's just me, I'll do interviews on some of them, is just to give you a short point of view, 9, 12 minutes. You can listen to these on your way to work. You can listen to these when you're taking a break. If you've got an Alexa or you've got an Echo Plus, you just say, Alexa, play Smart Injury Doctors. If you're in your car and you have a podcast, or you can go right to your podcast app and say, play Smart Injury Doctors podcasts. And you're going to get these short little programs that remind you of things that you may have known, or they're just shifting just a little bit. And it's these minor shifts that make a huge difference in your practice and can make a huge difference in your practice. So what I wanted to talk about was the confusing terms of chiropractic subluxation and the spinal instability and how they are actually identical. And once you start to look at it that way, standardizing examination procedures to locate and reduce them is very, very easy. Again, doctors, thank you very much for your time today. Put some comments below. Tell me below, what is the biggest thing that you struggle with in the injury space today? Tell me what, if you could have a magic wand, just remove some certain aspects. Or what is it that keeps you from being bigger in the injury market? Put those comments down below. I read them, I look at them, I appreciate them, and it gives me the understanding of what I may need to talk about in future podcasts. Doctors, thank you very much for your time.